medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Here's something I'm pretty sure you don't think about too often unless someone comes with a specific complaint, although it should be looked at all the time. And I'm talking about the interstitial fluid called saliva. Have you ever gone to the dentist and they looked at, examined, lab tested your saliva? Nope, me too. It's something we tend to forget about, but yet it is extremely important. 99% water, but 1% is all these different proteins and other typical markers that there is. Human saliva basically is compounds like electrolytes, mucus, antibacterial compounds. There are enzymes like amylase to help you reduce starches. And it has multiple functions, saliva. It rinses or solubilizes the food substances. It clears bacteria. It lubricates the tissues. It creates that bolus formation and swallowing mechanism, which allows the food to be digested properly. And by the way, speech facilitation and mastication, actually chewing, all are related to the fluid characteristics and specific components in saliva. So it is that important, but yet, how many of you ever thought about that recently when you see a patient? I can raise my hand. I have it. I'm Mitch Ghen, by the way, and thank you for watching this video. Saliva, basically, there are separate types of inflammatory biomarkers which have been associated with oral diseases as well as systemic diseases, and they are detectable in saliva, such as the markers of initiation of inflammation like interleukin 1b, interleukin 6, interleukin 8, things that you even see in tumors, which is like interleukin 8, and of course tumor necrosis factor alpha. An increasing number of specific molecular markers for different diseases like oral cancer, breast cancer, cardiovascular diseases, HIV, are now being identified, and they're in saliva. We may see the next era of evaluation and diagnostic things coming specifically from the evaluation and diagnostic studies that can be done on saliva. So if you look at these inflammatory markers that are in the mouth, you may have not only a very good way of knowing the mouth health, but also a predictability about other diseases that may be occurring. So just don't push the saliva away. Look in someone's mouth, of course, is my suggestion. Check for the amount of saliva that someone's making. And soon, hopefully, we'll have an easy way to differentiate these different transcription factors and determine what's going on. Remember, if someone has periodontal disease, and that is an extremely large part of the population, they may have significant inflammation markers in the saliva itself. And also remember that saliva IL-8, interleukin 8, is related to the growth of tumors. And if it is in the saliva and elsewhere, it may be part of the role, not only of growth of tumors, but its metastatic event eventually as well. I'm Dr. Mitch Ghen. For more information, go to Mitch Ghen or drmitchghen.com. That's drmitchghen.com. Thanks so much for watching.